Allogeneic stem cell transplantation in AML remains a vital part of the treatment armory, treatment pathway for patients undergoing intensive and now also non-intensive treatments. And it's likely that in the coming years, that as newer, more targeted, less intensive treatments become more and more available, that more patients will arrive fitter and be able to undergo reduced intensity conditioned transplants. So really the pathway remains very important in both the intensive and in the non-intensive arm, and really in the coming years I think the main improvements will be from better trials in terms of understanding what's the optimal conditioning regimen, incorporating MRD at both pre-transplant and post-transplant level, and subsequently maintenance studies. For example, in the UK there's an oral azacitidine maintenance trial called AMADEUS that's recruiting well, and all these trials will help really better understand how to optimize the pathway for these patients.